video I'm going to talk about acute lymphoid leukemia, also known as ALL. And ALL is basically a condition when the normal blood cells undergo a malignant transformation into cells that are essentially unable to mature into blood cells. So when you have this malignant transformation, there becomes a very, very large number of cells that are undifferentiated. And essentially what that means is that they have not been able to mature into the blood cells that you normally want. So what red blood cells are those? Well, you're talking about red blood cells, white blood cells, and platelets. So before we get into ALL, let's talk a little bit about blood. Blood essentially has cells, and then you have the plasma part of it. So the cells are also known as formed elements. And then the cells, basically, you have quite a few, but you can break them into three categories: red blood cells, white blood cells, and platelets. Now, we all know that the red blood cells are the ones that carry oxygen, and when somebody is anemic, it's referring to a low red blood cell count. White blood cells, we all know, are the ones that fight infection and help us when we acquire some sort of bacterial infection or other type of infection. And platelets are the cells that form blood clots and prevent us from bleeding to death, essentially. When these cells are not produced properly, you will get problems of anemia, you will get problems of infection, and you will get problems associated with bleeding. So that's very important to understand. So what happens when the normal stem cells, the normal blood stem cells, also known as hematopoietic cells, undergo this malignant transformation and become essentially blasts? Now, what on earth is a blast? It's just a term to it's a term used to describe precursor cells, or that are unable to mature further into blood cells. So normally, if the person didn't have leukemia, these blood stem cells would mature into red blood cells, like we talked about, white blood cells, and platelets, if everything was healthy. But in leukemia, because you have this malignant transformation, this is not able to happen, so you get these blasts, which are essentially cells that are unable to mature into proper blood cells. So that's the first problem. The second problem is that what happens is that the proliferation of these abnormal cells can also replace the normal bone marrow with these abnormal cells. And another thing that can happen is that certain organs can also be infiltrated by these abnormal cells, and that can cause those organs to enlarge. In particular, those organs are liver, the spleen, and the lymph nodes. So those of you who are familiar with the terminology, if the liver is enlarged, that's hepatomegaly; if the spleen is enlarged, that's splenomegaly; and if the lymph nodes are enlarged, that's lymphadenopathy. So we'll get into that. Just wanted to give you a key understanding of blood and blood cells before I get into the symptoms. So we have ALL. That's what we're going to talk about today. Before I jump right into the symptoms, I just want to talk about the fact that this is the most common pediatric cancer, interestingly. Most common pediatric cancer. And the average or peak incidence is between ages 2 to 5, with age 4 being the most common on licensing exams and in the real world as well. Okay, so now let's talk a little bit about symptoms. Well, instead of just memorizing all the symptoms, think about what happens, right? You have your normal cells that are not able to differentiate into red blood cells, white blood cells, or platelets. So if you don't get red blood cells, you have a situation of anemia. And if you don't get white blood cells, because white blood cells are involved in fighting infection, you get infections. And if you don't get platelets, you get bleeding. And all the symptoms that are involved in ALL stem from these three deficiencies. So instead of memorizing it, let's talk about it in a way that it makes sense. So if you're anemic, the first one, what type of symptoms would you have? Well, just think about if someone's anemic, they would essentially be pale, they would be fatigued, easy bruising, and then probably even have some shortness of breath. Infections. Well, infections can happen because of a wide variety of bacterial organisms and other types of organisms as well. But that one of the most common symptoms that would probably occur is a fever. And then finally, what are the symptoms if somebody has low platelet counts because those platelets haven't been developed? Well, bleeding, of course, is a symptom, but more specific symptoms or signs on physical exam include petechiae. Other things that can happen is a bloody nose, also known as epistaxis, and then bleeding gums as well. So instead of memorizing all this, just think about the key cells that have not been produced because of this unfortunate malignant transformation of the blood stem cells, and you'll understand why these symptoms are occurring. The next thing I wanted to mention is, I touched on it a little bit earlier, is that the cells can also infiltrate various organs, and that can result in the enlargement, hepatomegaly, when the cells infiltrate the liver and make the liver enlarged. And then the spleen is another one, so splenomegaly. And then, of course, the lymph nodes, and that would result in lymphadenopathy. Lymphadenopathy. Simply these terms, if you're a beginner, it simply means enlargement of those organs. So we talked a little bit about the symptoms. So if a child comes in with all these symptoms, what would be some of the initial tests you would do as a diagnostic workup? Well, the most common one, of course, is a CBC, also known as a complete blood count. And the CBC will tell you the red blood cell count, it will tell you the white blood cell count, and it will tell you the platelet count. And of course, you would expect that these would all be low. And I'll talk a little bit about that later. The next test you would do is a peripheral smear. It's very important because you will see, you can check this on the web for pictures of a peripheral blood smear, and they kind of look like pictures of blood cells, but what you're really looking for are blasts. Remember, we talked about those blasts. Blasts are basically the precursor cells that are unable to mature into proper blood cells. You'll see these blasts on the peripheral smear. The final one, you can also do a bone marrow exam to check for those blasts, because those blasts will be in the bone marrow as well. And then there's also very specific tests that they do called cytogenetics. I won't get into too much detail about that, but I just wanted to mention that real quick. More specific tests to diagnose leukemia. So how do you treat leukemia? Well, the treatment is actually an entire lecture in itself, but I'll just touch on it briefly. What I really wanted to touch on is the supportive care rather than the chemo. The chemotherapy, of course, there's very specific chemotherapic agents, drugs that are used to treat leukemia. But But the supportive care is what I really wanted to touch base on. In particular, it kind of helps to understand. Instead of memorizing the supportive care, I think it's very easy or much more better to understand what the supportive care does. Well, think about what's actually happening. And then platelets are low, right? Platelets. Well, if the red blood cells are low, the person is anemic. So you treat that by giving transfusions, blood transfusions. You can also, in addition to giving red blood cell transfusions, you can also give platelet transfusions. So it's not just red blood cells, but it's also platelets. And you can also give granulocytes, which is a type of white blood cell, in the transfusions as well. Granulocyte transfusions. So the transfusions are essentially a direct replacement of what was not produced because of the leukemia. The next part of the supportive care, I can kind of put it up here, is antibiotics or antimicrobial agents. So why are you giving that? Well, recall, if you have a low white blood cell count, you're prone to infections. So this is to treat the infections. And of course, it depends what infection the person has. And the final thing I wanted to mention in terms of supportive care is adequate hydration. And the reason for that is because when the leukemic cells lysis of these leukemic cells, they actually release large quantities of electrolytes such as potassium and other phosphate. And the hydration allows or prevents rather electrolyte imbalances such as hyperkalemia or hyperphosphatemia. So hydration to prevent electrolyte imbalances. So I hope that makes sense. Important things to understand rather than memorize, because if you memorize it won't make any sense whatsoever. Just want to finish off with a quick vignette. So you have a 5-year-old boy, 1 month history of fevers and lassitude, which is sort of like feeling weak, lethargy, weakness. He's found to have a severe anemia, so decreased red blood cells, moderate thrombocytopenia, which is decreased platelets, and a white blood cell count of 12,000. A bone marrow biopsy would reveal. Well, just want to touch on this briefly. What is a normal white blood cell count? It's about 4,500 to 10,000, I think. Well, if the child has a fever, that's signaling that he has an infection. And if the child has an infection, you'd think that the white blood cell count would be quite high. In any type of infection, the white blood cell count becomes high. But in this case, the white blood cell count isn't really that high. So it's actually counterintuitive. Well, the reason the white blood cell count is not that high is because he has leukemia. His blood stem cells are not able to mature into white blood cells the way they would if he was healthy. So what you would probably expect a very, very high white blood cell count of maybe 18,000 or more is not. He does not have the classic marked elevation of white blood cells. So he doesn't have a very high elevation of white blood cells. He has severe anemia. He has a low platelet count, and he's weak. He has all the classic symptoms of leukemia. And because of his age and the incidence involved in this type of leukemia, namely ALL, the most appropriate answer for this would be A.